well, what does sauna mean? Sauna just means whole body exposure to hot air. And the differences between how you heat the air is where the different types of saunas come in. So you can have an infrared sauna that uses infrared rays, kind of, one spectrum over from the microwave, where it heats objects a little more than the air. So that's an infrared sauna. Whereas something like an electrical, that's using radiant heat. So it's the source of the heat that tends to describe the type of sauna. And then when you think of a wet sauna or a steam sauna, that's where you have a source of moisture that's increasing the humidity.
Welcome to the Degrees of Health podcast. Dr. Joy Hussain is a medical practitioner promoting wellness and evidence-based sauna therapies. She completed her PhD at RMIT University on the topic of health effects of frequent sweating and sauna bathing. She's currently working to adapt sauna-based experimental protocols for lifestyle medical applications, such as cardiovascular disease, cardiac rehabilitation, and how the sauna can help women go through menopause. We cover the sauna with exercise benefits, we cover when females should and shouldn't use the sauna, and the human need to sweat. Imagine a pill that lowered Alzheimer's risk by 65%, increased runtime to exhaustion by 32%, lowered hypertension by 46%, reduced stroke risk by 62%. There is no pill, just the power of the sauna. With that, here's my conversation on all things sauna with Dr. Joy Hussain. Well, Dr. Joy Hussain, thank you so much for spending your time with us this morning. Or this afternoon, I should say, for you, this evening.
Yes, well, it's a pleasure to be here.
Well, pleasure to have you on. When I was trying to think of a first question for you, we were trawling through lots of your research you did, and you've been studying this for a reasonable amount of time now. And as someone who's studied the sauna so much, how have your own motivations changed from when you first started using it personally to coming at the end of all this research?
Well, it's been a good decade, you're right, since I started a PhD in it and then finished it a couple of years ago. Well, mostly it's experimenting with the mental benefits of sauna, probably. I fell into sauna bathing for the physical well-being, as well as I have Raynaud's syndrome, which is it's a spasm of the tiny capillaries that are in your fingers. And so I stumbled into using sauna as treatment for that initially, so for a physical reason. And so I wasn't surprised when I started doing my PhD early on and saw that most of the research early on is in cardiovascular benefits. And this is a vascular condition, so it makes sense. But what has changed me and made me grow into sauna more are the mental health benefits that I've been researching and seeing in myself and others, as well as seeing in the literature.
I mean, I'd love to dive into that at some point. I mean, the mental benefits, I feel like everyone who uses sauna regularly can relate to anecdotally, but I feel like the literature is just creeping up with that anecdotal feeling people can know intuitively.
Yes.
Would you agree with that? Is there literature sort of there or thereabouts with the mental health
yes,
side?
Well, how I discovered the mental health benefits was I conducted a large global sauna survey back in 2016. And it was online and involved 29 different countries. I had over 500 participants really complete quite an extensive questionnaire. It was like over 72 questions about their habits, about if they used it for medical reasons or why they sauna, what their motivations were. And what came out of that really surprised me. First of all, the top 3 reasons for using the sauna were not the top 3 reasons that were being researched in the science community. So, number 1 was for back pain. So a lot of people use sauna for back pain. Another one was other musculoskeletal pain. So other joints and issues. And then the other one was for a mental condition. And I was Yeah, I was kind of gobsmacked by that. I was like, wow, that's, I didn't realize that, but it started to make sense. And then also another finding in this global sauna survey, which is called a cross-sectional survey, is that over 86% said they slept better, not just for one night, but for 2 nights after using the sauna. And again, that made me stop and wonder and go, wow, if you're getting it for 2 nights, it's not just the acute effects. There's something else going on. And so those are the things that started to put my antenna out for studies that were looking at more mental well-being or mental health. And then there was one last thing, sorry, on
No,
the
please do.
or go ahead. I should let you. I should let
No, please. Tangents are great, and I love them. Please don't let me interrupt.
you. The other thing I did is I had embedded a mental and physical quality of life tool. It's called SF12. It was based on 12 questions that were in the survey. And what I found in those, the more frequently people sauna bathe, the higher their mental health scores were, not necessarily physical health. So again, it was another one of these light lightning moments where I said, wow, I think maybe we've just been focusing on physical, but there's a whole mental dimension.
Okay, well, I mean, if it's okay with you, should we dive into the mental dimension? I think that would be a great place to kick off.
Sure.
Do you like a proposed mechanism? How would that work? And I appreciate there's lots of different theories and hypotheses out there, but yeah, what
Well,
do you think?
there's a lot of different hormones, especially that are mediated through the hypothalamus that actually are activated when we're in heat and when we're sweating. So I actually think it's the combination. I'm not convinced it's only one or the other. I think it's a combination of our response, our thermoregulation to heat, which has a lot of mechanisms we're still working out, but they involve a lot of different neurohormonal pathways, as well as um, the actual sweating. I think there's a lot in sweat that we don't understand, and we're just on the tip of the iceberg. And in fact, I almost ended up doing my PhD on sweat alone because it was so fascinating. But thank goodness my PhD supervisor at the time, Mark Cohen, said, no, look, you were doing this for sauna, not for sweat. And I said, you're right. But sweat is fascinating. And I actually think a lot of communications, a lot of things come out in sweat, not just the detox kind of compounds that we think of. There's a lot of hormones in our sweat and a lot more fatty substances, fatty lipid-based molecules than we ever imagined. So,
Do
and
you think?
the other thing about sweating is it is so uniquely human. I think a lot of us spend a lot of time trying to get away from sweat and sweating and covering it up when really there are some evolutionary biologists who actually argue that sweating is what's allowed human beings to get to the top of the mammalian chain, because we're one of the few species that actually can still move, is not completely paralyzed by overheating. We actually can still function as long as we can sweat. That's the key.
Do you think there's a key to sweating and the mental health side of the coin?
Yes. I don't know what the connections are yet, but I'm just willing to place a bet that there is something about sweating. And I think most people you talk to after working up a good sweat, whether that be by exercise or by sauna, people describe this kind of purification. And in fact, there's a lot of historical literature about the feeling of purification that many of us get after being in a sauna. So I suspect there are hormones. Do we have it all worked out? No, I don't think so, but I think there's something to that. And then you had asked me originally about what has changed. Well, I also think there's probably something to contrast therapy too. I think whether that's double edges of the same sword, I'm not absolutely sure, because definitely with a cold immersion after following heat, you're not sweating, but I do wonder what type of pathways might be being activated and if they might be similar in terms of, and the other thing is our mind. I mean, we're still trying to figure out what are the mechanisms that go through our mind. It is still really early days, I think, with that.
I think the modern world puts a lot of emphasis on what can be quantified, and so if a feeling can't be quantified yet through academic peer-reviewed research, whatever it is, some people need that to actually give it a go. And I'd say that just through, I mean, Eloise and I's research and starting this podcast and having conversations with this community, you can see lots of anecdotal examples, but replicated for mental health in the sauna community and the cold community. And you can have there's this wonderful group in Edinburgh called Edinburgh Blue Balls. It's a men's mental health swimming group. And a lot of great anecdotes coming from there saying they don't know what it is, but something about the cold water and the connection, amazing for my mental health. And it really has been a game changer. And then similar anecdotes of the sauna. And I'd say to anyone who's sort of curious, maybe struggling with mental health at all, you don't necessarily need to wait for a paper, just give it a try. There's nothing lost, but a lot of anecdotes from that saying the mental health side of the coin is really, really boosted by the temperature.
And just looking at history, I mean, if you think about, say, some of the Native American ceremonies, about the sweat lodge, I mean, what is that sweat lodge? It is, in essence, a type of sauna with some spiritual overlay. So, and there's a lot of ayahuasca ceremonies in South America that are also around being in the heat. So, again, you asked me, do I think sweating and heat are involved with our mind? No question of it. It's just figuring out the pathways and figuring out how we can best adapt that or use that. And then you also said, yeah, give it a go. And I tend to say that to people because there's been a lot of, and over time, like when you look 20 years ago, there was a lot more caution around getting into saunas. Like, I don't know, I'm old enough to remember you'd see these little placards that say, look, if you have a cardiac or heart condition, please check with your doctor before you get into the sauna. And I remember later as I was starting my PhD, thinking about that and thinking, well, first of all, what is your doctor going to say? Because doctors are starting to wake up to uses of sauna, but what would they have said? And now I think we need to be reframing those placards because now we found that people with heart conditions are actually the ones who might best benefit physically from a sauna. So maybe we should say, these placards should say, please talk to your doctor about how best to use the sauna for your cardiac condition or heart condition.
I think that medical community, they're the ones who do need a lot more academic research to buy into this sort of the whole preventative medicine field. I think it was something like 92% of all medicine in Europe was the opposite of preventative medicine. It was they were waiting for something wrong and then they'll treat it. Although I think there's a shift coming. You talk about sweating. I know you studied it extensively. In a world of pollution and environmental toxins, how important is sweating on a regular basis? And then where does the sauna come into that?
Well, like I said, there's a lot more in sweating, not just there's physical content. And I think the pathways that get activated than we really know. And also there's a big, I think, disconnect between that detox. Detox actually creates a lot of issues in the medical community because most doctors or medical doctors, when they hear detoxification, we're actually thinking of pathways that involve the liver and the kidney more predominantly to remove things like heavy metals or a particular medication. Whereas really, I think the detox a lot of people talk about feeling, which I think is valid, is more that purification, more a clearance of metabolic toxins that are normally made there. I mean, when we exercise, we're creating metabolic toxins that need to be cleared. And I think that's one of the ways sweating helps clear. Now, having said that, I've also been involved in a study that documented in our sweat, we do have, at least here in Australia, the women that I studied had levels of organophosphate pesticides as well as synthetic pyrethroid pesticides. So we have these in our sweat, no question. And it's not just contamination. I did it very carefully in a field what's called metabolomics, where we show that it isn't just being contaminated from the outside. This is in our sweat, and it's coming from inside the sweat gland. But is that really our major clearance pathways for these types of toxins? I don't think so. I think it's an adjunct way of clearing some toxins, but I think mostly our liver and our kidneys are where most of that is happening. But could you, with repeated sweating, using the sauna frequently, the small amounts that are in our sweat, could that be clinically significant? Sure, over time. And in fact, there are some studies, usually that come out of the Scientologist community, that use it for like getting off drugs naturally. A lot of their protocols that were first created by Ron Hubbard, they're all very sauna intensive, like 5 hours of sauna a day, that type of intense, but with other interventions as well. So it's confusing. I think that whole term detox and detoxification just get confused.
I think yes. I think I can see that because it's a larger thing of how you can rid something through your liver and all these different things. You spoke about metabolic toxins. Can you give like an example of what's a metabolic toxin and why is it important to excrete or to sweat through the sweat?
Okay, well, and actually this is one of the mechanisms that gets talked about with sauna. When we exercise or even just breathing, we are creating what's called reactive oxygenated species. These are quite unstable molecules that are in our lungs that get into our bloodstream. And in fact, you're probably familiar with the terminology like antioxidants. Well, things like vitamin C and all these other supplements that can sometimes help the mechanisms to clear these reactive oxygenated species. And there are a few scattered studies that show that sauna does stimulate some of these pathways that reduce or clear some of these reactive oxygenated species. Do we have enough data to conclude anything? No. But do I suspect that that's playing a role? I do. And it would be interesting to see where that goes in the future.
Really interesting. I mean, there's all these, it's so faceted where all these different mechanisms play a part. And I think people want to pigeonhole one mechanism. So for example, going back to mental health, you get this whole community say it's all BDNF. It's all an increase in something called brain-derived neurotrophic factor, which there's correlations between people who aren't feeling so good mentally and low BDNF. But then you get people who say it's all inflammation. And so the lower the reactive oxygen species, the better the mental health. But actually, it can be a combination of everything. And I guess this is the hard thing from like a scientist like yourself of how do you control all these different factors and test for one individual? I mean, very hard job.
You can't. And that's, you're stumbling on a big flaw. I mean, we are multi-system beings and it's going on. And I think our model of scientific inquiry has always been very reductionist, like try to come up with a hypothesis that tests one thing and control for the others, when really that it's more and more difficult to do, especially when you're trying to study something like the sauna or like exercise that affects so many different pathways at the same time. So I prefer to look at trying to put together all the different things that could be happening and then work backwards to try and figure out. And instead of just focusing on one pathway. But I find this in medicine in general. It's that pharmaceutical mindset too of trying to be specific to one pathway, when I really think our living experience is actually multiple pathways going on continuously and synchronous, I'm not saying it right, but in synchrony too. So how to capture all of that in research studies or a randomized controls trial, with a control group, I just find that very confining in our thinking and our understanding.
It's hard. It's hard. I mean, if the study can be replicated, wonderful. I think there's got to be a pinch of salt of like directionally correct research, and hopefully that inspires others to do more research
Yeah, and
in that direction.
another complication with that is women versus men. So that's something in the sauna literature. Oh my gosh, women are totally discounted. There's only a handful of studies that are more and more now, thank goodness. But when I was doing my initial review 10 years ago, it was almost all men. They would always exclude women because it's well known that female hormones like estrogen and progesterone play a huge role in our thermoregulation. I mean, we know that think about the rhythm method and controlling fertility. It's all about tracking your body temperature until it reaches a certain point.
The rhythm method?
Yeah, well,
I'm not familiar with that.
Oh, okay. Most of us women to track before we had these wonderful apps, we used to track our periods by our body temperature. And what happens at ovulation, you get a rise of over 1 degree in your internal body temperature, which you could do from an oral temperature or from checking through your ear. And so that degree, that big step, is quite a confounder when you're studying something like an infrared sauna that, guess what, increases your internal body temperature by about 1 degree, which I've just shown in a recent study that I did with just women. So you can see, I can understand why they excluded women a lot in the beginning, but now it's very important that we include women because this is telling us that it's a lever. Sauna is a lever could be quite useful, especially in women. I mean, men too, but women particularly with the rise in the estrogen.
So what are the differences, and why do you say especially females have to take note of sauna?
Let's think about it. Women with their menstrual cycle, a monthly cycle, it's like an orchestra of hormone levels. And the orchestra has to be just right to get everything going for ovulation and to have our menstrual period. Men's testosterone levels, which is their major gender or sex hormone, tends to be much more stable through a day as well as through time in general. Whereas women, as we get older, things change. Obviously, when we go through puberty, things change. And then when we go through pregnancy, things change. And when we go through perimenopause, things change. These levels of these, relative levels of all these different hormones. So very different. And when you're studying something like sauna that influences thermoregulation, which is also influenced by these sex hormones so much, we need to be studying not only both, but separately too, to get a sense of how they could be different in their effects.
Are there any gender specific, actually female specific benefits of the sauna that our female listeners can take in their notebook of reasons why to sauna?
I was hoping you would ask that. I'm actually trying to set up a study right now looking at perimenopause when women suffer from hot flushes. Many women do. It's probably about 80% of women do. And I don't think it's an accident that we get hot flushes, something that's impacting our thermoregulation. And that's where I think sauna might be. I've got to test it, but definitely from my sauna survey results of a few years ago, it made me wonder if it could be beneficial for women. So one of the theories is that we live in this comfort crisis. I think there's a good book out about, that we keep ourselves comfortable, and that means not sweating. That means working, sleeping, always in these temperature controlled environments. And with us women, in particular, when we're about to go through menopause, perimenopause, which can be about 10 years before you actually go through menopause, you start to get fluctuations in your estrogen and progesterone levels. And considering how much that impacts your thermal regulation, that's what makes thermal regulation start to go awry. That's one of those first things. And my theory is and this is what I'd love to do a trial on, is if you have someone that's already exercising or using their thermoregulatory mechanisms regularly, maybe as your estrogen levels drop, maybe you won't be so susceptible to getting those hot flushes. And it's
Mm.
just something anecdotally I've noted in my community is those of us that regularly sauna didn't have as much issues with hot flushes as others. But do I have the studies to back that up? Not yet, but that's something that's near and dear to my heart that I really want to study next.
Not yet is the right answer. I love that. It makes me think of the study where they had Group A and Group B, and they put them both through a cycling program for 8 weeks. I think it was 8 weeks. Group A didn't have any sauna after. Group B had a 20-minute sauna after, and Group B were superior in all sort of cardiovascular fitness metrics at the end of it. And their proposed mechanism, and please correct me if I'm wrong, Joy, was they're essentially more heat adapted. Their thermoregulatory system was better able to handle the heat, and which happens in exercise as well. Is that like the similar mechanism to what you're thinking with this the hot flush? I guess it's better able
Yes.
to deal with
And in
hot
fact,
flushes.
I think you're referring to Dr. Lee's study, who he's done some great work, Eric Lee. And he's worked with I call it the king of sauna research, Jari Laakkonen out of Finland. And yes, I definitely think you're bringing up this. I think thermoregulation is the key. It's an adaptability and acclimatization that I think goes on. And I refer to it, I have a coin I use, or a coin term, I call it sauna fitness, which is almost similar to cardiac fitness or exercise fitness. And again, what is that fitness? That's that adaptability, that your body's ready to react appropriately to a stimulus. And I think, yes, I would totally agree with that conclusion that they said and that you understood from that study.
Okay, few. The I've been a long-term user of the sauna for a number of years now, and I used to do lots of reasonably competitive CrossFit, so basically exercise racing for people who have too much time on their hands. I used to wear a heart rate monitor around my sort of torso here, and
Uh-huh.
I'd do a workout and then wonderful get in the sauna for 20 minutes after. And
Mhm.
when I'd go back and look at my heart rate during the workout and then the sauna, you couldn't really see a distinction between when I was working out and then when I was in the sauna. And it's like from a heart point of view, it seemed like I was still exercising whilst I was in the sauna. Could you speak to that?
Well, yes, that's one of the studies that I've just done recently with women. And it was called, I called it infrared sauna as exercise mimetic, big question mark. And my conclusion from it is yes, I think a dry sauna, and we need to come back to this distinction, dry versus wet saunas. We'll come back to that. But definitely a dry sauna like an infrared sauna or like a Finnish style sauna um, does mimic a lot of the cardiovascular, so heart rate, blood pressure, heart rate variability, which we'll come to too. All of those are similar. What I noted to be different, though, the key physiological differences between infrared sauna and exercise, and I did aerobic exercise. I used an indoor bicycling with the women that I ran in my study. But the major difference was number one, the internal core body temperature. We're coming back to that. So definitely with an infrared sauna, you get a full degree higher than you do with exercise. So that was the number one thing. The number two thing I found is that you don't breathe as fast. So it's interesting that heart rate chest band that you wore. By any chance, it wasn't a Zephyr or anything that also tracked breathing, did it? Because I used a chest band heart rate monitor for the study I did.
If it did, I wasn't aware of the features. It's probably like a toy where I only use about 5% of it. I'm not unsure. I've still got it somewhere.
Well,
I'll
I'm
have a
willing
look.
to bet that you were not breathing as fast
In the
and
sauna?
not in the sauna as compared to when you were
Ah,
exercising. And you were not Therefore, we're not producing as many of those metabolic toxins I talked about, reactive oxygenated species. So that's one of the theories that I'm trying to put forth, is that actually sauna can be a great, quote, exercise, getting a lot of the same benefits, cardiovascular, but without the added stress of breathing and what comes with breathing fast. And think about it, or I think about it a lot with the patients that I see who have difficulty exercising. Usually, what's the difficulty? Well, sometimes it can be a physical difficulty, but usually it's that, oh, I just can't, I can't hack breathing. I'm just not fit. And that's where I think we might be able to use the sauna for those who have difficulty exercising. And I'm thinking particularly people who have lung difficulties, whether it's asthma or COPD, chronic obstructive pulmonary disease, or emphysema, it's sometimes called. These are the populations of people that I think could really get benefit from using the sauna for the cardiovascular benefits, but without putting all that extra stress on their pulmonary, on their lungs.
That is so interesting. So in the sauna, you breathe less, or you breathe more efficiently, would you say,
Yeah,
than
you
when you
breathe
exercise?
like at rest.
Wow.
So I actually did a controlled intervention when I put the women through these different interventions. And there was no difference between the breathing rate between sauna and when they were just doing like a control meditation. Whereas in the exercise, they were breathing a full 6 to 10 breaths per minute more compared
Wow.
to the others.
Am I right in saying lactic is a byproduct of oxygen?
Lactic acid it's going through a lot of permutations in our understandings. Yes, there is a kind of outdated concept that when we stress our muscles, especially in an anaerobic environment, then you produce a lot more lactic acid. But actually, lactic acid, in my understanding now, as a metabolite, is getting a lot more attention as not necessarily as bad as we used to think, and that it can cross the blood-brain barrier. And look, I'm not an expert on lactate metabolism, but my understanding about lactate is it's a lot more complicated than we used to think 20 years ago. So, so I haven't tested lactate levels, but I know that there's a lot of sports science research that's coming out about lactate. I've been listening to a lot of podcasts where I go, wow, there's a lot more going on there. And it may not be as, quote, bad as we used to view the quote, lactate accumulation hypotheses. So
Yeah, it's interesting. I mean, the only reason why sparking thoughts of if you're exercising and your lactic threshold, quote unquote, is a barrier to actually work your heart and your sort of your cardiovascular system, maybe the sauna is a way to sort of avoid that lactic but get the same aerobic benefits.
I have heard something similar, but I don't know enough to really weigh in on that argument.
Neither do I. Just getting excited after a coffee and a chat with you, Joy, which is great. So many different routes to go down here. It's so interesting.
Actually, could I revisit one of the things you brought up about, or we were talking about types of sauna. So what type of sauna do you do with your exercise?
For me, more so I used to live in Sydney, I used to live in Singapore, and then now I'm in London. And everywhere I had access to was always a dry sauna. So I've never actually been in infrared. Occasionally a wet sauna, but specifically dry for me. What about you? What about yourself?
Well, I have two different saunas in my clinic. I've got an infrared sauna as well as a larger, more traditional Finnish style sauna. So with an electric heater.
And what's the differences?
I view them as similar, but different a bit too in their effects. But that's purely anecdotal. I'm still, in fact, that study that I told you about where I compared infrared sauna to bicycling, I actually had I actually had a fourth arm that was a traditional sauna. But the gym that I was doing the study at, they sprang a leak in their traditional sauna. So they had to close it down and refurbish it, and I couldn't actually do that arm. But I would have loved to see if some of these physiological measures were going to be similar or different, especially the rise in temperature, the rise in body temperature. I would have been interested to see if it's as much, and the amount of sweating, because I did collect sweat. I didn't collect total body sweat, but I was collecting sweat with these different interventions too. And anecdotally, again, I didn't collect total body sweat, but those that were exercising produced more sweat, but it didn't stick around on their skin long enough for me to collect as much as it did on the infrared sauna. And in fact, I did measure skin temperatures, and no question of it, the infrared sauna was associated with a higher skin temperature. And I looked at 4 different places: foreheads, forearms, as well as the back. No question of it. There was higher skin temperatures with the infrared sauna as opposed to the bicycling.
Interesting. That so for can you explain what the difference is between a dry finish sauna and an infrared sauna?
Well, an infrared sauna is using, well, what does sauna mean? Sauna just means whole body exposure to hot air. And the differences between how you heat the air is where the different types of saunas come in. So you can have an infrared sauna that uses infrared rays, kind of, one spectrum over from the microwave, where it heats objects a little more than the air. So that's an infrared sauna. Whereas something like an electrical, that's using radiant heat. So it's the source of the heat that tends to describe the type of sauna. And then when you think of a wet sauna or a steam sauna, that's where you have a source of moisture that's increasing the humidity. And what's interesting about a steam sauna is I think it's actually an increase, well, based on looking at the studies so far. There's some good ones out of Poland and there's some good ones out of Germany. The cardiac load is higher, no question of it, with a steam sauna, or the higher the humidity is compared to a low humidity. And that has to do with our ability to thermoregulate when you're sweating or thermoregulate or sweating. So ironically, when you're in a steam sauna, you're not sweating as much because actually you can't sweat. There's this term we refer to as hydromyosis. When you actually moisten your skin, saturate it makes it so that there's nowhere to evaporate. I mean, how does sweating cool us off? It's that evaporation step. And think about it. How much can you evaporate in 100% humidity? Think about a humid day versus a dry day. Why is it more uncomfortable on a humid day? It's because you can't thermoregulate. You can't get rid of that sweat. So, and there was a nice German study. I think his name was Zek. It was a very funny study where they looked at the sweat content of men that were in the sauna versus and they radioactively labeled the water that was being poured over the stove in the Finnish sauna. And what they found is that the quote sweat that the men were having during the time of pouring the water, with the high humidity, it had more to do with the water in the air than it had water that was tagged into people sweating. So, and then in Poland, there's a Dr. Wanda Pilch has done a wonderful set of studies. It was her and her whole lab. Sizua, I think was his name. I'm not pronouncing their names very right, but there was a whole series where they've looked at men and women separately, and no question of it, the load on the cardiac, the blood pressure, the heart rate, all the responses, it's more intense with the same temperature, but with humidity being increased.
That's really interesting. I've felt that the steam room or the hammam, I don't know what the official term is, a wet sauna, I'm sure. Anecdotally, it's a lot harder after exercise. It's more of a fight, more of a dog fight.
Well, it's because you are exerting more. Now, I have no idea whether we breathe as hard. In fact, it makes me wonder whether our respiratory rate might be more increased in the steam sauna. Don't know. We haven't done the studies yet, but I would
Ah,
love to. That's something that I think could be going on. And look, I part of me would it be too simple to say, oh, but I think a dry sauna is better for you because it's associated with more sweating. But I can tell you from my sauna survey, there is a dedicated group of people that find more health benefits with the steam sauna compared to the dry sauna. So I'm not going to go there. We still got a lot of exploring to do on that one.
it's so interesting. I think a lot of the literature is dominated in dry Finnish sauna because it's mostly come out of Finland, right? So
Yeah.
maybe there's like a literature bias there. Why I would
Yeah.
love to. I'd be so interested to read this study, which to my knowledge doesn't exist, but where you have two groups of the same exercise program, but the only difference in variable is a 20-minute sauna, dry, finished dry, and then a wet sauna, and to see who has more sort of cardiovascular gains at the end of it.
Well, that's the Polish studies. That's the Polish research group. I can send you those. Pilch is her name. And they've done a series of that where they've looked at it. And no question, they've concluded that they didn't do breathing rate, but they've concluded that heart rate and blood pressure responses are associated with a higher load in the steam sauna compared to the.
Ah,
So
so you
they
could,
did that. I'll try and send you those studies.
yeah, please do.
There's
I'd that's a nice Saturday morning for me. So great.
yeah. No, and so that's it's that and that study that the Germans did about sweat content and where is the water coming from. You know, these labels, these radioactively labeled hydrogens that they used. Where is it coming from? Well, definitely. So when you're in a steam sauna, you're condensing the moisture in the air onto your skin much more than you're actually producing sweat from the inside of your body. And that's one of the major differences. Which one is associated with better health? That remains to be seen.
So okay, so to the listener who's reasonably new to sauna, what
Okay.
would you say to them, like digesting all this? That okay, do I do infrared? Do I just do dry sauna? My gym only has a dry sauna. What would you say is like a rough introductory protocol to start sauning?
Well, I'm going to go back to the analogy we were talking about with exercise. So it's very individualized. It depends on how fit you are, how sauna fit, how exercise fit, how cardiorespiratory fit you are, what medical issues you have. Are you a man? Are you a woman? Do you suffer from other medical conditions? You know, all of these have to play a role before we start prescribing saunas in medicine. And that is one of my huge research interests is how do we adapt the sauna to help us in treating especially medical conditions. So, you know, I would say, look, if you're someone who has any type of chronic fatigue syndromes or finds exercise difficult, you might want to start with an infrared sauna where it's operating at a lower temperature. Usually, a lot of the studies and a lot of the most common use is at 60 degrees centigrade, as opposed to the Finnish style or the more traditional or the like the Russian banya they tend to run at a higher, you know, anywhere from 70 to 100 degrees Celsius. So look at that load. And then certainly if you have issues with that, I would not be going into a steam sauna straight away. I would tend to gravitate towards the dry. Now there's also with women, I think it's important to, but I can't prove it yet, but I'm suspecting it's important to sync it with your menstrual cycle. So I don't know if you're familiar with Mindy Pelz's work. She's a chiropractic doctor out of the US, but she's written some great books like Fast Like a Girl, The Menopause Reset. And she does such a good job of talking about how we get into trouble with exercise or fasting as women when we try and do these things at the wrong time in our cycle. And I'm suspecting sauna works the same way. I'm suspecting that if you're going to try sauna or really go hard on it, the best time to do it is in the what's called follicular phase, in the beginning of your menstrual cycle, like just after you've started your period. And for the 2 weeks after that, that's the kind of what Mindy Pelz has called the power phase. And I suspect that's where exercise and sauna could best benefit women. Now, can I prove that yet? No, not yet. But it makes sense in that beginning of the cycle, our body temperature is a lot lower. It's that full degree lower. So we have more room to play with that thermoregulation versus in the later half of our cycle in the luteal phase. We've got that we're already running hot, if that makes sense. But a lot of this is we're in the evidence-free zone, but this is a zone I love, and there's a lot of room to move in that. And I think I can't wait to see how we can use these levers around that.
Well, I guess that's what it's all about. I mean, it seems like the whole idea is to develop a hypothesis and try and prove it wrong, right?
Yes.
I think that's really, really useful and interesting information there, Joy. What is all-cause mortality? What does that mean?
All-cause mortality means you're referring to like an epidemiological term, which is
yes,
how much of a percent of a population dies prematurely from a different condition. And so, yes, in the Finnish sauna studies, it's quite remarkable. I mean, these are called observational cohort studies. So what they've done in Finland is they took over 2,000, it was men to start with. They are following women now. But again, like I said, it's always gotten started with men. So over 20 years ago, Jari Laukkanen, the king of sauna research that I was mentioning before, he really had a great vision where he started following these men for cardiovascular outcomes. So things like all-cause mortality, rate of heart attacks, rate of stroke. And he also, because it's Finland, kept track of their sauna habits. And so this was a landmark study that came out in 2015 that just blew everyone's mind. And I was mid-PhD at the time, and I was like, oh, if the universe is sending me a sign to keep studying sauna, this is it. And he showed that, there was nearly 2/3 less. That's huge. All-cause mortality deaths for those that more frequently sauna. Now, the catch is, what is frequently sauning? Well, in Finland, that's 4 or more times a week. Now, for us mere mortals in the rest of the world that don't have maybe that kind of access to a sauna, that's a harder outcome to achieve. People are starting to do it. Like, I aim for 3 times a week. If I can get to 3 times a week, I know, okay, I'm doing. But in terms of like treating myself for that Raynaud syndrome I talked to you about, it's actually much less frequent. I found that as long as I sauna at least once every 2 weeks, which really isn't that much when you think about it, I can keep my vascular condition at bay. I mean, I feel, quote, cured. I forget I have it as long as I'm getting to the sauna at least every 2 weeks.
And I know a few people with Raynaud's. So your Raynaud's is kept at bay through a regular sauna practice.
Regular sauna. And I totally stumbled on this. This is actually the motivation for doing the PhD, because I worked in Alaska for a number of years earlier on in my career, and I had bad Raynaud's at the time. I grew up in California. Sunny California really hadn't had much to do with snow or anything. And when I accepted this position in Alaska, I still remember feeling, oh no, how am I going to deal with that cold? My fingers, I can just feel the pain already. And then something happened. I mean, I got there and I signed up for 2 years, ended up staying for 5 years because I loved it so much. But what did I start doing? Well, I started regular sauning. That's what everyone did in the wintertime. That was our major social. It was a major social thing. And we need to come back to the social effects of sauna, because that's really important too. But anyway, I didn't get it. Still, after finishing up in Alaska, I moved to Alice Springs, of all places, one of the hottest places in the world. And my Raynaud's started to come back within 3 months of moving to Alice Springs. And I remember thinking at the time, that's weird. Again, I still didn't put it together. It wasn't until my husband and I moved to Melbourne, which is a colder climate, and we ended up building a sauna because we were missing it for social reasons more than anything else. And it was when I started sauna bathing regularly. And this was nearly 10 years later that I went, oh my gosh, my Raynaud's is gone again. And that's when the bell went off. And that's when I said, oh my, we need to start studying saunas. And it nicely coincided with Jari Laakkonen's studies just 2 years later that came out. So,
okay, wonderful. So
yeah.
you mentioned the social side of the sauna. I
Yes.
mean, it's again, I think it's one of those things people feel anecdotally. Been in a sauna, and actually, for some reason, the context actually lends itself to good conversation, open conversation. It's quite a vulnerable thing to do. Could you speak to what the social side of the sauna is, and how does it affect you?
Well, this gets to possibly one of the differences between infrared saunas and Finnish style or more traditional style saunas. And it has mostly to do with the cultural overlay. You know, infrared saunas have come out more in Western, kind of in the US and Australia and places where there isn't so much of a culture overlay. And it tends to be marketed to an individual, or they're smaller. And the nature of infrared radiation energy too, it doesn't have as much of a length as a radiant electric one, or wood burning, or smoke saunas, the more traditional types. So, and I forget what we were talking about. We were
Sorry.
talking about,
Yeah.
oh yeah.
Yeah. There's something about the connection to do with saunas,
Yes.
and why
The social.
people connect.
Yeah,
Is there?
that's it.
Yeah.
Yeah. Sorry.
Okay.
I just got off track there. Yeah. So what I think is that in the more collective, more the Finnish style sauna, I think there's a lot of community that happens around that. And I know it's happened with us with our Finnish style one, which is a little larger than the infrared sauna. So I tend to, that one we sauna regularly with our neighbors, and you tend to, I mean, we're cheapskates, so we tend not to run it unless more than one person's kind of into doing the sauna that night. So I really find there's a lot of talking that goes on. It's hard to stay angry in the sauna. I think there's all kinds of mental health things going on. I also think, remember I talked about the stuff that's happening in sweat content. I think a lot of hormones, a lot of quote pheromones or whatever you want to call it, communicating immune chemicals are getting exchanged between people. Can I prove that yet? No, but that's another study I'd love to do, is what are the aerosolized compounds that are happening, that are getting exchanged in the sauna? I suspect there is something to that. Now, can you get that in an infrared sauna? Sure, they're starting to make larger ones, and I suspect maybe that, but that's not the way the marketing has gone so far.
It's something. There's lots of. I mean, you could sit here and think of lots of proposed mechanisms of why the sauna lends itself to social connection. I mean, whether it's like a shared physiological state, whether it's a massive rush of endorphins that get followed by dynorphin, or or the how do you say this? The pheromonal, is that a word?
Yes.
Yes, the pheromonal effects. What happens? I heard you say on a podcast. What happens when people shake their hands? When people shake hands and are observed?
Yeah, they did a fascinating study that I think this was around 10 or 15 years ago. I stumbled on this early on in my PhD thesis, that it was a psychology group, I think in the US that did this study, or maybe it was the UK, can't remember. But they were videotaping people when they introduce each other and shake hands, and watching what they did. And what was fascinating is people weren't aware of it, but almost everyone, after you shake someone's hand, was somehow smelling their hand. It was getting near their face. Their hands would somehow, and it's just something they noticed as they were reviewing all the videotapes. And then this whole hypothesis came that maybe because we sweat a lot with our hands, that maybe when you're shaking, you're exchanging sweat and you're assessing. You know, again, there's all these things going on in our brain that we are clueless about. And I do wonder, like animals, I mean, watch our pets. What are the first thing they do? They smell each other. They get a lot more out of smelling than they do at looking at each other. And I think that's something that we can wake up to this and think about our nose. That's the sense that's closest to the brain. So, and I actually, this is another idea. I have so many ideas around sauna, but mixing aromatherapy with sauna. Oh my gosh, I think there's a power in that that is totally unexplored, because it is in some of the cultural traditions. Like when I toured saunas with the International Sauna Congress 5 years ago, we went through all different types of saunas, and a lot of the um, Northern European, they'll often mix herbs and shake it around and during a sauna. So there's the power of using different plant-based scents and molecules that I think are incorporating a lot of the cultural traditions that haven't reached mainstream yet. But I think there's something to that. And again, I would love to start to analyze some of that.
Oh, well, I'd love to read. I'd love to read it when you do. And yeah,
I'll keep you posted.
please do. Please do. I've learned a lot during this conversation, especially it seems like the combination of factors as opposed to just one isolated thing
Yes.
can lead to sort of greater sort of exponential health impacts from so many different points of view. Really, really fascinating. All this literature is amazing. Where do you think it's going, Joy?
Well, I think we are in a crisis right now. Most of us will acknowledge that um, cardiovascular disease is the leading cause of premature death all over the world, not just rich countries, but also now the poor, some of the less socioeconomic well off. They're also, we are in an obesity crisis, especially in the US, but it's happening everywhere I've been traveling. I'm seeing people heavier and heavier. Um, and I think it's lifestyle changes, some of which we can control, some of which we can't, like the quality of our food and things like that, that have gotten us into this mess. And I think saunas as a tool, a lifestyle tool that works on many different mechanisms, the same way that the lifestyle forces that have gotten us into this mess, I think sauna will be very useful for getting us out of this mess. And that's how I see the future. I see, at least medicinally, I think sauna can be used to help a lot of these populations that are no longer staying active, aren't getting the multi-system benefits of exercise. This might be a way, I think, to access some of those and get people more active. I think this is something that in my speaking with Eric Lee, we've talked about some of his studies. A lot of our back and forth, he's talked about using the sauna to make exercise more accessible. And I think, as opposed to using it in place of exercise. And that's where we differ a little bit. I think as a practitioner, I struggle a lot of times getting people who don't like to exercise. And so I see sauna as maybe a way in place of that exercise. But I understand his coming from an exercise physiology point of view of how it can be used. So I get it. And that's how I see the future. That's where I see it going.
Yeah, I mean, it's such an evolving literature, and it's so interesting to keep up with. I've got alerts on my emails, anything that comes through, I get reading. I think paired with the growing social research coming out, where whatever it is, an island, a tribe, a group, you need one. And I think a sauna is a really lovely place to congregate, and you get this lovely twin benefit of all these health benefits plus the social benefits, which actually are the health benefits at the same time.
Yes. And in fact, something we haven't mentioned but deserves a lot of mention is that Jari Laakkonen in those big cohort studies also demonstrated there was much less incidence of dementia among those who frequently saunaed the 4 times a week or more. And that's another one of those scourges that it's happening right now. And I think it's the mental health, social side of sauna that might be at play there, not just the cardiovascular effects. And because we know that dementia isn't purely a cardiovascular mechanism driven, there's more involved there.
So the mechanism. Yeah, okay. I can see how you can argue for the social, as in you need people to stimulate that side of the brain. But whilst Okay, sorry, I'm catching up here.
Yes, and in fact, when you look at dementia interventions right now, the ones that work the best are exercise and social interaction. Those are, in fact, those are the only two things where there's some decent evidence. All the medications are not much better than placebo. So, but those two things, and isn't it interesting? Those are the two things that there's the most weight of evidence with sauna. So that's another direction I really see. And you had mentioned you dropped the line of brain-derived
Neurotrophic.
BDNF, and I'm forgetting what the N stands for. Brain-derived
Neurotrophic factor, I think.
neurotropic factor. Well, we're trying to get some evidence to show that increases with sauna. Now, there is some preliminary stuff, but it was done more in animals, I believe, and that's another pet peeve of mine. not to make a funny joke about that, but I really think because sweating and our thermoregulation is so uniquely, our mechanisms are so unique in humans, I really struggle with the research that is trying to look at sauna in animals to try and enlighten our understanding of sauna in humans. And I think we're talking about two different things. Again, animals don't sweat. I've seen sauna studies of hamsters, rats, mice, and I look at them and go, they don't sweat like we do. And sweating isn't their major thermoregulatory response. It's panting, it's breathing. And I already told you, we don't breathe fast when we're in the sauna. So, we're thermoregulating very differently. And the BDNF, a lot of the mechanistic studies are done in animals, or were started in animals. Like I'm thinking of some Japanese studies and some old Russian and German studies. And that's another problem, is English as a language. I mean, English is the language of science right now, but that wasn't the case in the past. And a lot of early sauna studies were done in German and Russian and a lot of the Northern European languages that we still haven't gotten translated, these studies. But now, because technology is growing so quickly, and it's difficult to justify going back to translate those studies when we'll always argue that they weren't using the same level of technology. So that's another problem with the sauna literature.
Well, Joy, I want to pull on all those threads and spend all day talking to you about all this stuff. Really fascinating. And I can't tell you how much I appreciate your time. I really, really enjoyed that conversation. Where can we find you, Joy? Where can listeners read more about what you're up to and following your journey?
Well, I have a website for my clinic as well as my research. It's called healthwithjoy.com.au, and you can find me there. You can find all my studies are linked there. But also I'm very open to, that's where you can leave me a comment or ask questions. I love sauna related questions. Now, can I get to all of them? Not always, but I love seeing what people are wondering, because it inspires the kind of research that I want to do in the future, is understanding what are people noticing. Because really, we're the best. The best researchers are the citizen researchers. And that's another study I want to set up, is a citizen research sauna study where people, come back. But anyway, I know I can keep digressing, and I know we're limited.
We'll have to do a part 2, Joy. I mean, there's so much we didn't cover. I'd love to get into.
I would love that.
Great. Well, Joy, thanks so much for your time, and we'll see you soon.
Thanks, Ben. All right.